Good morning. If you have decided to study and you want to become a professional hypnotherapist, keep watching our training videos about clinical hypnosis. Hypnotherapy is an effective technique with which you can help and improve the quality of life of a large number of your future patients. Remember, read the description of this video where you can find a link to free training classes on clinical hypnosis. And also, you can download several ebooks also free. The information in this video is extracted from our book Direct Clinical Hypnosis, Deep Hypnosis, of our publisher Clinical Hypnotherapy, registered with ISBN. Let's continue with primary, secondary and tertiary exercises part 5. Positive reinforcement incorporates a new behavior, increases an existing behavior, or eliminates an incompatible, inappropriate behavior. Positive reinforcement is done with a reward-focused visualization. I want you to look great. You have overcome your problem. You are a new person. Or visualize yourself as a strong person who has fought and succeeded. Your family and yourself feel very proud of your achievements because you have overcome everything. Practically, it consists of associating a prize with a correctly performed behavior. Naturally, not just any type of reward is valid. It has to be exactly the reward that the patient is aiming for with the therapy. Negative reinforcement. Negative reinforcement is the increase in the probability of behavior as a consequence of the omission of a stimulus. In summary, negative reinforcement through the response of behavior eliminates the aversive stimulus that precedes it. Therefore, an increase is given to the behavior that caused the elimination or disappearance of the stimulus. Practically, it consists of removing the reward when an incorrect behavior is carried out. Not to be confused with punishment, aversive, although in hypnosis both are often used or combined. You must drink alcohol in a responsible and moderate way to be serene. In that way, you will avoid that they see an unpleasant and not very respectable image of you. The difference with positive reinforcement is that here something in the environment, being seen drunk, is being eliminated, being seen drunk. Negative reinforcement through behavior eliminates the aversive stimulus that precedes it. Don't drink behavior, or you will be seen drunk, aversive stimulus. Therefore, the behavior that has caused the disappearance of the stimulus, not drinking, is increased. Now I want you to look like you just drank and you are drunk. The image you are projecting to others is that of an unpleasant person, not a respectable, negative image. Assuming that the addictive and or compulsive patient responds appropriately to the aversion applied, the negative reinforcement supposes an added punishment at the moment in which he or she feels the temptation to skip and behaviorally breach a previously established behavioral exercise. A common response in patients who observe a continuous addiction, very prolonged episodes and or strong doses. Example. Now I want you to see how you are tempted to addictive action and you start to do it, even though it tastes so unpleasant that it makes you vomit. Example of development of type 2 aversion in the case of an ingested addictive object, and even though you have to throw it away because of the strong vomiting taste, I want you to see how just the attempt has produced that. Psycho image of added punishment. For example, in case of dieting, that you gained the weight you had lost during the whole day. All the efforts of the day has just been lost in that attempt you made, even though you could only take a bite and throw it away because of its vomitous taste. The added punishment must be adapted to the addictive behavior action of the patient in the aspect that most affects the distortion of his image and as emotionally, linguistically harsh as possible. It might seem that these developments of therapy could have a counterproductive effect on self-esteem, since it hurts the patient's emotional sensitivity concerning his self-image. However, since later in the session we'll be working on self-esteem with a focus on other goals, it does not present compatibility problems. Aversion and negative reinforcement usually always go together, since both are self-reinforcing, producing a beta-modeled behavior response. However, the use or combination of both is at the therapist's discretion. Post-hypnotic order. The post-hypnotic order would be a summary of the whole session. It is important to put this order in a positive way, as positive as possible, avoiding negative comments. From now on, you will never again have the need to binge eat. You will always eat just enough and with a high level of control. A lot of control on your part. You will never again binge eat. You have learned to control your eating. Now you know how to eat what your body needs. I want you to know that you are a great girl. Now you have learned to control your eating. From now on, you know how to eat what your body needs. I want you to know that you are a great girl, nice, hardworking, slim, beautiful, very beautiful, attractive, very attractive, interesting, very interesting, and above all, successful. Because you always get what you want. And now you want to heal, recover, and have a slim and slender body. You know you are going to get it. You know it. In fact, you have almost got it. You are on the right track. You deserve the best. You deserve it. From now on, every day and in every way, you will feel better. Better and better. Better and better. Better and better. Whispering. The whispering technique will always be placed after the post-hypnotic command. You can also do the post-hypnotic command by whispering. That is, instead of saying it by speaking normally, we say it by whispering it. Listen and feel my words. Whisper in your ear. Burn every word I whisper to you. And beat every word I whisper to you deep in your mind. Listen and feel everything I'm going to tell you, like a soft and pleasant wind whispering through the leaves of the trees. Life is a matter of priorities, and your top priority is to recover, restore you, heal you, and overcome all your fears. I have given my all to help you. Now I only wait for you. Everything depends on you. If you want to, you can. Willing is power. And you want to recover. You want to restore you. You want to heal and overcome all your fears. You are going to get it. You deserve it. You deserve to recover. You deserve to restore you. You deserve to restore you. You deserve to heal and overcome all your fears. You deserve it. If you're interested in knowing more about clinical hypnosis, watch our next video, Direct Clinical Hypnosis, Diagnosis and Treatment, Primary, Secondary and Tertiary Exercises Part 6. Remember, with the description of this video you can find a link to free training classes on clinical hypnosis. And also, you can download 3 free ebooks. If you have any questions, add them in the comments area. On this topic and many others we'll talk about in the channel and in the videos that we'll publish. So, if you're interested, do not miss our next videos. Thank you very much for your interest.